Measles outbreak explodes across the U.S. Texas at the epicenter, 70 hospitalized. A shocking surge in measles cases is sweeping across the United States, with the federal government confirming a staggering 483 confirmed infections across 20 states in 2024. The crisis is alarmingly concentrated in Texas, which has become the epicenter of this devastating outbreak, accounting for the vast majority of cases. A chilling 70 individuals nationwide have required hospitalization, highlighting the severe and potentially life-threatening nature of this resurgence. Texas is bearing the brunt of this public health emergency. As of March 28, the state's health department reported a staggering 400 confirmed measles cases, a figure that underscores the urgent need for immediate and decisive action. This outbreak isn't just a matter of numbers. It's a human tragedy unfolding in real time, with lives at stake and families grappling with the devastating consequences of this preventable disease. The scale of the Texas outbreak alone demands a national conversation about vaccine hesitancy and its catastrophic repercussions. The shadow of misinformation looms large over this crisis. U.S. Health Secretary Robert F. Kennedy Jr.'s past pronouncements casting doubt on the safety and efficacy of vaccines, despite overwhelming scientific consensus, have undeniably contributed to the current climate of vaccine hesitancy. While Kennedy has recently acknowledged the severity of the Texas outbreak, his earlier statements have undoubtedly fueled the anti-vaccine movement, creating a fertile ground for the resurgence of this preventable disease. His influence, unfortunately, extends beyond mere rhetoric. A deeply disturbing trend emerging from this crisis involves the dangerous self-medication practices being promoted within anti-vaccine circles. The New York Times recently highlighted the tragic case of children suffering severe complications, including liver damage, after receiving dangerously high doses of vitamin A at home, administered without medical supervision. This reckless practice is directly linked to the misinformation campaigns waged by vaccine skeptics, including some of the very same individuals who continue to downplay the importance of vaccination. This outbreak is not merely a public health challenge, it's a profound societal failure. The collective inaction, fueled by misinformation and mistrust in established medical authorities, has created an environment where a preventable disease is causing widespread suffering and threatening lives. The sheer number of hospitalizations serves as a stark warning. The consequences of vaccine hesitancy are real, tangible, and devastating. The urgent need for widespread vaccination is undeniable. The scientific evidence supporting the safety and effectiveness of the measles vaccine is overwhelming and irrefutable. This crisis demands a multi-pronged approach. Increased public health messaging, emphasizing the critical importance of vaccination, robust community outreach programs targeting vulnerable populations, and a concerted effort to counter the spread of dangerous misinformation that undermines public trust in science and medicine. We must collectively address the underlying causes of vaccine hesitancy and aggressively combat the spread of this preventable disease before it claims more lives. The situation demands a renewed commitment to public health initiatives, enhanced community engagement, and a firm stance against the dangerous spread of misinformation. The lives of countless individuals depend on our collective action. The time for complacency is over. The time for decisive action is now. We must work together to stem the tide of this devastating outbreak and protect our communities from the preventable suffering caused by this easily controlled disease. The future health of our nation hangs in the balance.